Welcome everybody to this evening's webinar, which is on the topic of the Down Syndrome Act Statutory Draft Guidance Consultation. We're delighted to have you with us this evening. So very quick agenda to tell you what we're going to be talking about this evening. So in a second, I'm going to hand over to Carol Boys, who will give a brief introduction and welcome. We will be covering some background in relation to the Down Syndrome Act, which is what this consultation relates to. We'll provide you some information about the actual consultation itself. We'll give you details of the Easy Read consultation, some tips for engaging in consultations. So that will be broad tips for how to engage with consultations generally. And there will also be a question and answer session as well. So we will try and answer as many questions as we can during the session today. So we'd ask that you use the Q&A function for questions to the panel, who will be introduced to you shortly. We don't have the chat function open to us this evening, so it is just the Q&A. So please do use that. If, though, you have any other questions or questions that don't get answered this evening, you're welcome to email us on the policy@downs-syndrome.org.uk email address. And just to say, this session is being recorded and it will be shared on our YouTube channel and website. It's likely to be a couple of weeks because we need to allow time just to edit and top and tail it. So if you keep an eye on our channels in maybe 10 to 14 days' time, this will be made available for you. So if I could hand over to Carol, please.
Hi, everybody. I'm Carol, Chief Executive of the Down Syndrome Association, and I'm joined this evening by my colleagues, Gillian Bird, who is our Services Director, Sharon Smith, our Policy and Parliamentary Lead, and Julian Hallett, our Services Development Manager. As Sharon put it so well, we will be talking about the DSA's involvement in the development of the guidance for the Down Syndrome Act, more information about what we think about the guidance, and how you can get involved with the consultation that's running at the moment, which is really important because people do need to be responding to that consultation. So I'm going to hand you back to Sharon, and I hope you enjoy our webinar.
Thank you, Carol. So during the session this evening, I will be presenting most of the slides. Julian is going to take over for a few of those shortly to talk about the Down Syndrome Association's involvement during basically from the time the Down Syndrome Act gained royal assent through to now. We will then I will present some more slides and we'll have a Q&A session that Gillian Bird is going to chair for us. It may well be that we answer some questions as we go along in the Q&A. If they are ones that we can easily answer by typing a response, then we will do so. But if not, we will come to look at those questions at the end. We hope to finish, well, definitely we'll finish by 8:30 p.m. this evening, but if we can finish earlier than that and let you have more of your evenings back, then we will do so. So just a quick overview as to why we're here, why we have some guidance that is being consulted on by the Department of Health and Social Care. So the Down Syndrome Act 2022 originated from a private member's bill that was tabled by the MP Dr. Liam Fox. It was introduced into Parliament in late spring 2020. There was basically, as there is every year, a ballot for MPs to see which MPs are able to table private members' bills, and Dr. Liam Fox was successful, and then he was lobbied to have his private members' bill to be about Down syndrome. The bill, as it was drafted by Dr. Liam Fox and others, received cross-party support as it progressed through parliamentary processes and scrutiny. And it's important to recognise that when there is a private member's bill, it follows a different path through Parliament in terms of scrutiny and also public consultation. So there wasn't a period of time, as there might be with a green paper or a white paper, where the public were able to respond to the contents of the Act or bill at the time, to be able to give their feedback on what should be in it, what it should cover, and also which individuals should be included within that piece of legislation. So as I said, it gained cross-party support. So all parties, all political parties supported this bill, this piece of legislation as it was developed. And in April 2022, it gained royal assent, which means that the Down Syndrome Bill became the Down Syndrome Act 2022. So it's a piece of primary legislation. And the intention behind the bill was to offer to certain public authorities in the provision of services under existing legislation to those with Down syndrome. So basically, public authorities are already required under existing legislation to provide a range of services to people who have Down syndrome. And the intention behind the bill was that there would be a publication of guidance that would ensure that those public authorities, those bodies, would be able to take into account the specific needs of people who have Down syndrome when they were undertaking relevant duties. So the main part of the Down Syndrome Act was that the Secretary of State needed to publish some guidance for these public authorities to have due regard to. And that's where we're at today. So 3.5 years later, we have the first draft of that guidance that is being published for public consultation. And this is the opportunity for the public to feedback on what's in the draft guidance and also an annex, which I'll come on to explain. So in April 2022, the Down Syndrome Act, as I said, gained royal assent, and the Department of Health and Social Care began a period of consultation with a whole range of stakeholders. And that period of engagement and consultation and collaboration has been continuing up to today. There was a call for evidence that the department opened, which ran for 16 weeks until 8th of November 2022. And I'm going to pass over now to Julian to tell you more about how the Down Syndrome Association was involved during that call for evidence period and also between then and today. Julian, over to you. Thank you.
Okay, thank you, Sharon. So if we move on to the next slide, I'm going to, oh, sorry, no, it is this slide. I'm going to take you back to that period of 2022. So as Sharon has already said, the Act received royal assent in the April of that year. And in that period, then over the summer and into the autumn, the announcement was made that the Department of Health and Social Care were going to put a call out to stakeholders, to anybody who was interested, to submit what they were calling a call for evidence. So this was relevant information that we felt, or families or professionals or royal colleges, anybody with an interest in supporting people with Down syndrome could submit what they felt would be good practice, and that would be collected together in one document. The Down Syndrome Association, as you probably know, has a very well developed network of adults who have Down syndrome who work very closely with the team in the DSA called Our Voice, and we did a series of engagement events right over that summer and autumn period involving adults who have Down syndrome to help inform our response. I think we ran, I had to look back, I think it was about 20 different events over that 3 or 4 month period. Some were for our affiliated support groups, some were for family carers. We did some in the afternoon, some in the evening, some for professionals, and obviously a number of activities that were particularly aimed at adults who have Down syndrome for them to share their lived experience. There was also an easy read document, and we worked with Our Voice right at the beginning of this process to develop a film, because obviously easy read is easier to understand, but it won't be accessible for everybody. So we worked with some adults who have Down syndrome to produce a sort of promotional film to try and encourage as many people, many families, and many individuals to respond as possible. And we engaged with our affiliated support group network. Obviously, they were individually submitting their own response, but we sort of try to assist that by giving them, a bit like the day that we're doing this evening, to give them as much information as possible. So we go on to the next slide. And then once the call for evidence period ended, there was a lot of work going on in the background. So, there were huge numbers of responses. I think just under about 1,000 responses were received. So obviously it took a team of civil servants quite a long time to actually analyse all that and look particularly for common themes. So, as you might understand in this process, lots of people were saying similar things. So the more that was amplified, the more likely that was to make it into the eventual call for evidence paper. They then established an advisory group. So this was called a stakeholder group, which consisted of probably about 25 or 30 different individuals drawn from the voluntary sector, from various professional backgrounds, health representation, ICBs, local authorities, the sort of all of the key stakeholders that you might imagine would be part of that stakeholder group. And that began meeting in January 2023. Various staff across the organisation, many of us in the information and training team, the policy team, obviously Carol as chief executive, engaged directly with the team that were responsible for pulling that advisory group together. We were allocated a particular place at that table for an individual who had Down syndrome, an adult with Down syndrome, to share their lived experience. We just sort of facilitated that. So very much Sam, the guy with Down syndrome who sat in the group and shared his experience, really did that very much himself. We did a little bit of preparation work so that we could make the meetings as accessible for him as possible, but he obviously said what he wanted to and contributed to those meetings as he wished. And then if we go on to the next slide. So the call for evidence findings have only actually been published very recently. So if you go on to the consultation page, which Sharon is going to talk about in quite a bit more detail, you will actually see that they have now published all of those responses. That isn't actually being consulted on because that's obviously a historical document now. It's been used to inform the next stages of the guidance and the sort of process that will sit behind the Act. But if you want to read that is available for public view. So if we go to the next slide, what the call for evidence, if you like, so that collection of information that was submitted went to produce what has been called a needs profile paper. So we know that individuals with Down syndrome obviously are all very different. So there's no typical person with Down syndrome, but there are particular things that we know in relation to health, for example, in relation to good practice in schools, information around employment, things that we know are good practice, and pulling all of that together in one place. Again, this has been published, but it isn't being consulted on. It is a very useful document, and particularly, I think, for various professionals that are working in this field, it is a very good, rich document that has all of the information about Down syndrome in one place, and it's pulled all of that very diverse information into one document. So we're not being asked to consult on that, but it is there as a sort of supplementary document. And then if we move to the next slide, I think now we're going back to Sharon. So so that gives you a bit of a whistle-stop tour, really, of that process that extended probably for about 18 months from 2022. One thing I should say, obviously, in the middle of that, as you probably will remember, we had a general election in July 2024. So there's a period of purdah when new policy documents can't be produced. So there was a bit of a pause during that period, and we had various new ministers and obviously a new government then just over 18 months ago.
I think it's also worth mentioning as well, Julian, that the civil servants who have been working on the Down Syndrome Act there have been several iterations and teams who have been working on this as well. So the Down Syndrome Association has had to get to lots of different civil servants during this process, and obviously different ministers have been responsible for it as well. I just wanted to go back actually to the needs profile paper slide, just to say that the Department of Health and Social Care have made it very clear that this needs profile has definitely originated from the call for evidence process and the evidence that was submitted. And some of that evidence is also information that the department have gone and found themselves, but by no means is this a systematic literature review. It doesn't necessarily cover every single piece of academic research or medical research or information about the needs of people who have Down syndrome. So it is worth just bearing that in mind if you do refer to the needs profile paper. However, despite that, it is still a very comprehensive document, and it is something, again, that we as an organisation have had an opportunity to feed into and to draw attention to things that we felt needed to be included. So in terms of the draft statutory guidance that has now been published for the public and stakeholders and interested parties to comment on, the guidance document itself brings together existing statutory requirements and guidance. So, for example, the SEND Code of Practice is statutory guidance, so that's mentioned, for example. And this is existing statutory duties that relevant authorities must or should already be complying with to support people who have Down syndrome and people who have other conditions and or a learning disability who might have similar needs. And I will come on and explain all of these things in a little bit more detail as well as we go on. But I think what's important to say up front is that the guidance itself is only reflecting the existing statutory framework or frameworks that are in place for people who have a range of disabilities or additional needs. There isn't any new duties that have been brought about from the Down Syndrome Act other than a requirement for the relevant authorities to have due regard to this guidance document once it's finalised and published. And there's also no additional funding either. So the guidance is only statutory guidance for those who are specified in the schedule to the Down Syndrome Act. So within the Down Syndrome Act, I've put the link here and we can share links with you after the event. Basically, it sets out within the schedule which authorities need to have due regard to the guidance once it's published, and also in relation to which of their duties. So it will have, within the Down Syndrome Act, it has a schedule that talks about, for example, housing or education, social care, health, and it tells you which relevant authorities have to pay due regard to that section of the guidance. It becomes clear if you go and have a look at the Act and also actually the guidance document as well. The guidance itself, or the draft guidance, I should say, currently includes 7 sections. So the first section is accessible and person-centred services. Then there is a chapter, as you would probably expect, on healthcare, one on social care, one on education and preparation for adulthood, meaningful employment, appropriate housing, and then the seventh section is about where to find help and support. And that final section basically brings together all of the different routes for redress. So, for example, if there is something within the guidance that you are not receiving, it tells you the appropriate routes that you need to take to be able to secure that provision for yourself, if you are someone who has Down syndrome, or for your family member or the person that you're caring for. And those routes of redress are the same routes of redress that already existed prior to the Down Syndrome Act. So the Down Syndrome Act didn't provide any additional ways of actually challenging if services are not being provided. It just details within the guidance the existing routes and the ways that you should progress any, as I say, any complaints or any concerns. What is useful is, of course, having all of this in one place and in one document. So I have a daughter who has Down syndrome, and certainly I would have found it useful in her younger years to have all of this in one document, rather than me having to know how to find information about, for example, different education acts, the Children and Families Act, the Care Act, etc. So the guidance document itself is very much setting out what legislative duties exist for different relevant authorities. And that is something that is likely to be of use to people, potentially people who have Down syndrome, but also their families and carers as well. So at the beginning of each of those, the first 6 sections, so not the final section, which, as I've said, is all about how do you resolve if you have any issues or any complaints or you're seeking redress. But in the first 6, there is a summary that tells you who the section is aimed at, and that sets out clearly which relevant authorities that section also applies to. It details what the relevant needs of people who have Down syndrome are, and then obviously it says what the guidance says. So in terms of those legal frameworks, and also there are occasionally some best practice examples woven into. Each section also explains how the guidance could be relevant to people who have other conditions, so other genetic conditions, or a learning disability who might have similar needs. And again, I will come on and talk about that briefly in a little while. So this is an example. I've just basically went and took a screenshot from the draft statutory guidance, and this shows you, this was section 2, high quality and holistic healthcare. And you can see it says this section describes the health services and support that a person with Down syndrome may access throughout their life, including support before and after birth and during childhood, so they can have a good start in life. And it sets out information about who has responsibility for planning and delivering health services, and also reasonable adjustments to care that can make it easier for people who have Down syndrome to access the support they need. So those reasonable adjustments coming from the Equality Act. And then it talks about who that section is for. And obviously the health section is for people who are planning and commissioning health services, people who are providing health services in the community, such as GPs, dentists, pharmacists, etc. And people providing health services in hospitals, paid carers of people who have Down syndrome, and then, of course, people who have Down syndrome, their families and carers, and the wider public to see what services and support they can expect to be offered. And as I've said, that is the services and support they can expect to be offered under existing legislative frameworks and funding. I just want to take a moment to talk about some of the language that is used in the guidance document. So at different places, it will say must, or should, or could, or might be able to, for example. And these actually have legal standing. So if it says the word must, this is reflecting a legal obligation that exists in current primary or secondary legislation or case law. And it means that this is essential to follow with no exceptions. So these are legal obligations that are not imposed by the Down Syndrome Act, but are already legal obligations under other legislation. So if there are things in that guidance that say must, then you would be expecting that those are things that will definitely be provided to you. And if they are not being, then you are able to obviously follow those routes of redress that are in section 7. One of the other words that is used frequently throughout the guidance is the word should. And this is basically saying that the relevant authorities, again within whichever section you're looking at, are expected to follow the recommendations that are set out. So they should be doing it unless there is a good reason not to. And if they depart from the guidance, they should set out the reasons why, and that should be documented clearly. So should is not just optional. It is a really strong word to say that this is what should definitely be happening. And if it isn't happening, there should be an explanation as to why it's not happening. And then it also can say may, can, or could. And this means that it's guidance that could be followed. It's an example of good practice, but also there isn't necessarily an expectation that the relevant authorities will do this. It's something that could be helpful. It's something that may be useful, but it doesn't mean that they have to do it or have to explain if they don't do it and set out and document why. And it's really important that that distinction in the language is made clear, because often, and I know this from previous policy work that I've been involved with, people, when responding to consultation documents and guidance like this, will often feel, well, that should be a must, and I want that there to be a must as well. But unless it is in primary legislation or secondary legislation or case law, then it's not something that is going to have the word must. So I just wanted to sort of set that out and make that clear at the outset. The other piece of language in terms of legal language that we need to be aware of is have due regard. So again, the relevant authorities that are listed in the schedule in the Down Syndrome Act must have due regard to this statutory guidance once it's published. And this means that they must give careful and meaningful consideration to the guidance when exercising the functions that are listed in the schedule. This means they should consider whether and how the guidance can be applied when exercising those functions. So, for example, when commissioning health services or looking at how education is being provided locally. They must take into account any countervailing or opposing factors that are proper and reasonable to be considered. They should consider the guidance as part of the process of carrying out their functions and also record the steps they have taken to demonstrate they've had due regard to the guidance and any departure from it as well and the reasons why. Now, one of the things that has been included within the Down Syndrome Act, which some people might find surprising, given that it is obviously the Down Syndrome Act and relating to people who have Down syndrome, is that throughout the guidance, it talks about people who have other genetic conditions and disabilities. Now, this came from a commitment that was made both in the House of Commons by the MP Gillian Keegan and also in the House of Lords by Lord Kamal to consider the need for including people who might have very similar, if not identical, needs at times to people who have Down syndrome. They wanted to ensure that there was not a perceived hierarchy, that some people were seen to be maybe more worthy than others of receiving support or treatment or commissioned services. So this wording has been taken directly out of the guidance, as has the next slide as well. And again, one of the reasons why this is so important is due to a piece of existing legislation, which is the Equalities Act. So we need to make sure that all disabled people have access to the same level of services and are not discriminated against because, for example, they don't have Down syndrome. So this is from the actual guidance, and I'm going to read it out. So it says, we know there are many people who have chromosomal conditions other than Down syndrome, a genetic condition and or a learning disability. For example, there are currently approximately 1.3 million people who have a learning disability in England, many of whom have other conditions that give rise to similar needs to people who have Down syndrome. And these people should be equally served through existing duties. And I think this is really important for us to remember as well. Obviously, as the Down Syndrome Association, we are here to support people who have Down syndrome and their families, carers, people who, professionals who are supporting them, and anybody who has an interest in Down syndrome. But if there's approximately 40,000 people in the UK who have Down syndrome, there's 1.3 million people who have learning disability in England. So we're actually quite a small group of individuals in relation to that larger total. And then this is also from the guidance. It says, it is our expectation that this guidance will help improve support for people with Down syndrome and for those with other conditions and/or a learning disability who have similar needs too. Importantly, the Down Syndrome Act does not require and is not intended to provide enhanced or additional care and treatment for those who have Down syndrome over and above other groups of disabled people or people with other conditions and/or a learning disability who have similar needs. So it's really important for professionals who are having due regard to this guidance to not give preferential treatment to an individual who has Down syndrome over and above somebody who maybe has a different genetic condition or an unnamed syndrome or a learning disability who is presenting with very similar needs. It's important, and the Down Syndrome Association would always say this anyway, that individual needs are always assessed and that there aren't blanket policies just because somebody has a particular diagnosis. So it's important those who are working in education, health, social care, housing, etc., get to know the individual, get to understand their specific needs, and that there is person-centred planning as well throughout. So some key information about the consultation. It was launched on the 5th of November and it closes on the 28th of January 2026 at 23:59 p.m. Don't miss this date. Basically, there is an online form that you can fill in and we'll give you all of the links for this. But after that date, the consultation period will be closed. Now, the consultation is actually consulting and asking for feedback on two things. It's asking for your feedback on the draft statutory guidance and also an annex. And the annex is setting out some best practice and recommended resources. And that is something that we would really encourage people to engage with, particularly the annex part. And if you have had support from the Down Syndrome Association and found some of our resources particularly useful, and you think that they should be within that annex and they're not, then we would urge you to feed that back and let the department know. As I've said, the draft statutory guidance, the document itself, is primarily setting out about the sort of legal duties, what provision you should be expecting. But in terms of it actually being best practice or recommended resources, etc., the annex is where those would be. Now, once this consultation closes, and we don't know how long this period is going to take afterwards, the Department of Health and Social Care will obviously review and analyse all of the responses that they've had. And at some point, as I say, we don't know how long it will be, they will publish the final Down Syndrome Act 2022 statutory guidance. And once that is published as the formal final guidance, then the relevant authorities within the Down Syndrome Act will need to have due regard to it. During this consultation period and until the moment it is published, it is still only draft guidance and it doesn't need to be followed. Although, of course, all of those existing legislative duties do exist currently. So it might still be a useful document for people to refer to at least know what they should be expecting at the moment. So the Guidance, the consultation is all on this link. This link can be found on our website, by the way. We have a page about the Down Syndrome Act. So if at any point you can't find this information, and Google should serve it up to you, but if it doesn't, if you go to our website and just type in the search button, search box, sorry, Down Syndrome Act, a page will come up on our website, and this is linked from that page. Now, this link takes you to the consultation document itself. So it would set out all of the questions that they're asking, and also have the online form so that you can fill that in and submit your response. It has obviously the draft statutory guidance as well. It has the annex of resources and examples of good practice, and there is also a published equality impact assessment. Now, that is there for information. Again, that's not something that's being consulted on, but it might be worth going and have a read of that as well, just for information before you respond to the consultation. There is an easy read version of the guidance that has been published, and there is also an easy read consultation document as well, and they're available on a separate link, which is here, and again you can find that through our website too. I last checked this page last week, and it said that there would be a British Sign Language version of the draft guidance and consultation being published in due course. As of last Thursday when I checked, it still hadn't yet been published, but hopefully that will be coming soon. So this is the link for the consultation questions, and again we can share any of these links with you. And I just want to now talk about what the consultation actually looks like, so that when you go to have a look at it, you've at least got a sense of what to expect. So the first part of it, when you go to the questions, it will ask you some demographic information. So, for example, if you're responding as an individual, it probably asks you things such as your gender and your age. If you're an organisation, it wants to know, obviously, which organisation you're responding on behalf of and in what capacity. Then the first section asks you for your views on the draft guidance as a whole. So it is just asking you, and I'll give some examples of some of the questions shortly, but it would be asking you basically, is this draft guidance comprehensive? Is this guidance going to be helpful for people who have Down syndrome, and those types of questions. Then there are some optional sections which you can choose whether or not you respond to, or you could just respond to part of this. You don't have to respond to all of it. Again, it might depend on your personal or your professional interests. So you can respond to each chapter. So for example, if you've got an interest in education, you could talk about your views on the draft guidance as a whole and then just answer the education section and then submit. Or you might have views on all of the six sections and want to feedback on all of them. The other opportunity you have to feedback is about the inclusion of guidance for people who have other genetic conditions or learning disabilities. And then the last thing that you can feedback on is the resources and the examples of good practice that are set out in the annex as well. So these are all optional. You can respond to those or not. It's up to you. We would definitely urge you to respond to the resources and examples of good practice annex though. Particularly if you are somebody who has obviously used our resources, but also if you're a professional who has got resources or has accessed training or information that you think needs to be shared within that good practice annex, then it is definitely worth sharing as part of your response. Now, most of the questions are actually fairly limited in terms of what you can contribute to this consultation. So throughout the document, there are statements, and I'm going to come on the next slide to show you an example. And those statements give you options from strongly agree through to strongly disagree or don't know. And then there is an optional box for you to add further comments or what further changes you might like to see. But there's a maximum of 200 words in those boxes. Now, I believe that the easy read version doesn't have that 200 word limit on it, but certainly the online version that they're expecting the majority of people to respond to has a 200 word limit in those questions. So this is an example. I'm just going to look to my other screen because it's quite small for me here. This is from healthcare. This is from the healthcare section. And the first question is a question for individuals sharing their personal views and experiences. Again, this is a screenshot from the document itself. So it asks, to what extent do you agree or disagree with the following statement? And the statement is, the guidance provides clear information about the healthcare support available to people with Down syndrome. So then you can respond that you strongly agree that it does, all the way through to you strongly disagree and you don't think it gives clear information, or you're not sure. And then there's a question for everybody. So whether you are a professional, whether you are an individual who has Down syndrome or a family carer, whether you're an organisation, you can answer this question, which is saying again, to what extent do you agree or disagree? The guidance clearly sets out the importance of health and care staff having the right skills, knowledge and training to provide high quality and holistic healthcare for people with Down syndrome. And then as you can see below that, it says, what changes, if any, do you think are needed to make this section, high quality and holistic healthcare, clearer? And there's a maximum of 200 words. So you're going to have to be quite disciplined and quite succinct in terms of your responses, depending on what you're wanting to say in those boxes. It also makes it very clear here that the department will obviously take into account any feedback that people have given, but they might not make changes as a result of the feedback that has been sent in as part of this consultation. So in terms of our website, we have got, as I've said, a dedicated page about the Down Syndrome Act. As you can see on this screenshot in the top right corner, there is a search button where you can just type in the word Down Syndrome Act and this page will come up. We have a range of information on here, including some information obviously about the consultation itself. With all of the links to the government pages. We have information on there. There's a previous FAQ document and also a document about the legal status of the Down Syndrome Act, both of which were produced in 2022 during the call for evidence period. We have an initial statement from Carol Boyes, our Chief Executive, about the Down Syndrome Act guidance consultation. And there's just some other interesting bits of information on there. For instance, a longer piece of information about how the DSA has been involved. I know Julian gave you a summary already, but there's more information about that on our website. And obviously there's our contact details on there and you can contact us too if you have any other questions. So I think, oh, sorry, I've got some more to tell you about responding to consultations and then we'll open for Q&A. We have produced a guide. This is not a guide that is about the Down Syndrome Act. This is a guide about all policy consultations. So whether it is a call for evidence, whether it's a green paper, whether it's a white paper, or whether it's a consultation such as this one. And it is available on our website. It's available on the Down Syndrome Act page, so you can have a look at it. We also have an easy read guide to consultations as well, which if it's not on that page, it will be within the next few days. So if you're wanting to support somebody who has Down syndrome to engage in this consultation and they don't know what a consultation is, that easy read guide will also be really useful for you as well to have a look at. Some tips for responding to consultations, particularly if you're really new to this. It's always worth starting at the beginning with the summary or the easy read version. I often find myself heading to the easy read version of any consultation document and then going back and having a look at the main consultation because I've got a sense of what it's about, some of the terminology, and also the structure of it as well. It's really important, obviously, to look at the questions that you are being asked and obviously to respond to those as clearly as you can. But also you can sometimes answer the answers and say things that you're wanting to say in those 200-word boxes, even if it's not quite the question that is being asked, so that you can get your views across as well. It's important for you to think about your own experience, whether that's you as a parent, whether it's you as a carer, or as a professional in that professional capacity, as a guide and as your starting point. You don't have to use complex or professional sounding language when you're responding to consultation documents. In fact, actually, it's often better if you don't, because it's going to be civil servants who are going to be reading and analysing, or sometimes external consultancies are also brought in with consultations as well. And they don't necessarily know the terminology, all the acronyms, and all of the detail that you might go into. So you don't have to do that. Make it as simple as possible in terms of your response and really clearly explain your points. And wherever possible, draw on real life examples and case studies as well. Bearing in mind on this consultation, though, you only have 200 words in each of those boxes, so you might not have space to do that. You don't have to answer every question. With some consultations, they will mark and say which ones are compulsory. But as I've said already, you can use all the available spaces to say what you want to say. Politicians' answers. So you can say, that's a great question, but what I really want to tell you about is this. It's worth using headings, bullet points, keeping your text really concise. As I've said, always check word limits on your responses. You don't want to be halfway through a paragraph and then realise actually you've just run out of words. So you want to plan those responses before you start typing them into the online form. And you can also search for published commentaries or responses from organisations or individuals for ideas on what to say. There are at the moment several organisations who are holding information events like this about the Down Syndrome Act. I know that Learning Disability England, I think they have a session next week, and other genetic condition organisations are reaching out to their members to get them to engage in this consultation as well. So you may start to see people publishing commentaries or their views on it, and that might give you a starting point as to something that you might want to talk about in your response. Obviously, nobody's wanting to influence you and tell you what you should say though. So I'm going to stop sharing my screen in a second. And also then we will open the floor for a question and answer session, which Jill is going to chair. Before I do that, I just want to say we are really grateful, obviously, for all of you joining us today. At the end of the session, I'm going to put this slide back up. The webinar, obviously, that we've delivered this evening has been delivered to you free of charge. Today is Giving Tuesday, and if you're feeling generous and you'd like to make a donation, a small donation, however small, to the DSA, we would be super grateful. But I'm going to stop sharing my screen and then we can come back and share this right at the end after we've finished answering all of your questions. Over to you, Jill.
Yes. The first question is, why was it called the Down Syndrome Act if it covers so many other people? I don't know who'd like to take that. I can start you off if you wanted.
Okay.
Well, to say it is about the needs of people with Down syndrome. It is a single place where you can, professionals, parents can find out really useful things in one place. But other people may have those same needs too. And it comes back to what Sharon said about legally. If they have the same needs, the same things apply for them. But it is about the needs of people with Down syndrome, primarily. Right. Anybody like to add something further to that?
I think just to reiterate what I sort of said earlier in terms of how this legislation came about in the first place. It was a private member's bill that Dr. Liam Fox put forward. He was lobbied by and has personal connections to people who have Down syndrome and families and carers. And he made it very clear that he wanted it to absolutely be about and for people who have Down syndrome. It was during the passage of the bill. Private members' bills still have to go through various stages of scrutiny, and although there wasn't much scrutiny on this because there was cross-party support, Once it reached the House of Lords, there were some questions being raised by some of the Lords in terms of again, as Jill just said, well, there are people who've got other genetic conditions or who have got learning disabilities who have similar needs, whose needs are not being represented. And we need to make sure there's a level playing field. And also, we have the Equality Act, which also sets out clearly in law that their needs also need to be considered. I wouldn't say it was necessarily a concession was made, but more of a promise was made by both Gillian Keegan in the House of Commons and also Lord Kamal in the House of Lords that any guidance and obviously any resources and best practice, etc., would take into account the needs of those individuals, recognising, I think, actually, that status and the importance of the Equality Act in particular. So that's why. And in terms of then, obviously, it's not changed its name because it is still an act. It was still a private member's bill that was very much about and for initially people who have Down syndrome. I don't know, Carol or Julian, if you have anything to add to that.
I think it's important to say that the bill could very well have run out of time in the Lords had those promises not been made.
Yes.
So.
And again, that's because it was a private member's bill, which means that it needs to be completed in one parliamentary session, whereas other pieces of legislation that are being developed that are maybe being initiated by the government can go over from 1 year to another year because they take slightly longer to develop. But with a private member's bill, because of the very nature of that mechanism to generate legislation, as Carol said, it potentially would have run out had there been any amendments tabled in the House of Lords.
And there wouldn't have been a Down Act in that situation. So, yes. That's why we ended up in where we are. Sorry, Julian, did you want to say something?
I was just going to say I'm minded to remember one of the comments from a parent at one of our consultation events in the evidence gathering process who said obviously she wanted the very best for her child who had Down syndrome, but that her child had many friends, non-disabled friends and other friends who had a learning disability. Some had a genetic condition, others just had a learning disability not attributed to having Down syndrome. And, she would want the best for her child, but also other children, friends, people that they had grown up with and were, part of their lives, really. So it was sort of everybody benefiting from this, if that was possible.
Thank you. The next question is, are there any particular concerns you have with the Act or areas where you feel additional input is needed? Who would like to answer that? I could add a little comment, give you every time to think. I mean, just that I feel a bit close to it because we've been on the advisory group. And so it feels like for years we have been feeding back views and concerns and additional things. We've been doing that.
Yeah.
And some of those have been taken into consideration. But I don't know if all of them have actually, but because we've been very close to it. And do you think that's fair to say, other people involved?
Yeah, I agree with you. We fed back an awful lot of information, and some of it has been taken up, and some of it hasn't. But I think, as these things go, there's an awful lot of useful information in there, as Sharon said. It brings everything together in one place, and that's a really useful thing to have.
Yeah, I think we also have to remember that the Act itself, and again, maybe this is part of because it was a private member's bill, and we know that Dr. Fox was wanting to ensure it had the smoothest passage as possible through the scrutiny and the different processes as it went through the stages. It didn't bring about any additional legislative duties for people who have Down syndrome. It didn't bring about any additional funding. The main requirement of the Act itself was to produce the guidance. So in terms of any concerns with the Act, I'd say the Act itself was fairly limited, and certainly it's quite short compared to lots of other pieces of legislation. In terms of where additional input is needed, I think the one area that we would really welcome people to contribute and to feedback on is the annex. It's not clear at the moment how the contents within the annex have been chosen, what criteria has been used by the department to pick out certain things. And we think there is room within that annex for there to be more good practices and examples of good practice, including obviously our own resources that are evidence-based and are often actually written by and produced with either with our voice members or with our specialist advisors or the Down Syndrome Medical Interest Group or whoever else we might be working with. So I think that for us, that is one of the gaps at the moment, and we would be keen to encourage people, particularly if you have found our resources or our training useful, to be able to highlight that in your responses. I don't know, Jill or Carol.
You have answered the next question.
Oh, okay.
Which is, what is the view of the DSA on this? Is there anything where a consistent voice from carers' family would be welcome or helpful? And also the person thanks you for running the webinar.
Yeah, I think absolutely. Where I think most families and carers are going to find it quite difficult to comment on the actual guidance itself, because unless you know legislation really well, and don't get me wrong, I know that lots of families do, because we often feel we have to, and we have to get to know the Children and Families Act and the SEND Code of Practice and all of those things. But unless you know those and you are working with them regularly, then the guidance itself is going to be hard to actually respond to, I would say. We will be doing a detailed and robust response to that in due course, and we'll be working with our voice. I should have said that in our presentation, actually. Over between now and the middle to end of January, we'll be working with our voice to get their views on the guidance and the easy read version. I think that the main area, as I've just sort of said in answer to the last question, where family members can really engage with this is around the annex, the best practice, where you have used and relied on information and resources that have been helpful, then feed that back and let the department know. We think there's room for more to be in that annex, because at the moment, as we said, under each heading, there's just 2 or 3 different things. So there's space for more. Carol, over to you.
It is thin on the ground, particularly on housing and social care, I think. That we have a lot of best practice that we need to get in there, that's for sure. But we will, don't worry, we will push hard to get that in there. But it would be great if people who've had experience of that kind of support from us could detail that in their response. That would be lovely.
Another question. Is this Act going to make a real difference to people with Down syndrome and their families with things that we deal with daily? For example, GPs making reasonable adjustments. They're either unaware, don't have the time and resources, or just don't follow the guidance.
I wonder if Julian might be able to talk a little bit about some of the work you've been doing with the ICBs and training.
Yes, I mean, as Sharon has already alluded to, it is an extension of what already is in place. So, it is a requirement that services make reasonable adjustments. So people who have a learning disability have a protected characteristic, and providers need to take that into account when they deliver their services. One of the really good things about the sort of run up to where we are now is that it's harnessed the DSA's ability to engage with integrated care boards in England. So we developed a particular strand of training that focused on exactly what you're talking about, the particular health profile of people with Down syndrome. If I'm a GP, or I'm a hospital receptionist, or I'm a clinician working in a general hospital, what particular things do I need to know if I'm going to be preparing to see a patient that happens to have Down syndrome? And we know all that. There's a lot of really good practice. It's not rocket science, but it is just putting all of that in one place. And the Down Syndrome Act has been a mechanism for engaging. There's been an understanding, because ICBs have had to appoint an executive lead for Down syndrome, so they've been named individuals that we've been able to connect with. Sharon and I had a meeting just this morning with an ICB because they're interested in thinking about how they are going to respond to this consultation process, because they'll be one of the key stakeholders that will need to be responding.
Yes. So in summary, it's already made a difference, which we hope will have a knock-on effect on making lives easier for people. It's made a difference in the interest in our training and uptake on training, hasn't it?
Yeah. We're also doing other work with NHS England on something called the Reasonable Adjustments Digital Flag program, which we will be detailing in journals and newsletters to come. If that program, the pilots have worked very well for that program, and if that program is rolled out, then a lot more information will be available to GPs and anybody really, from paramedics arriving to deal with someone who has a learning disability, who might have collapsed or become suddenly ill. A lot more information will be available from that point right through to being hospitalized about an individual, a lot more information about an individual and their needs and the reasonable adjustments that they require. So we've been working very hard on that with NHS England and other organisations in the learning disability world. So we're really pleased about that, and fingers crossed it won't be too long before that is introduced.
And then a similar question to the last one. What do you think the main impact of the Act will be if there's no new legislative duties? Is it the recognition of people with Down syndrome and the ease of finding relevant legislation or information, etc.?
I certainly think, as a mother of a young lady who has Down syndrome, having all of that relevant legislation in one place will definitely be useful. She's nearly 21, so we're going through that sort of transition towards her developing independence and getting greater support from adult social care and housing, and all of that is a complete unknown to me, and it is legislation I'm now going to have to learn that I haven't had to learn in quite the same detail as obviously all the education and children's social care legislation. So I certainly think that it will be useful. I think also the fact that as Julian has already talked about, and Jill and Carol, there will be a recognition of the needs of people who have Down syndrome. in relation to sort of authorities as they are discharging their existing duties because of this guidance. So.
Okay, are there any more questions?
There was one I answered by typing, which was for Mags, asking if the REACH standards for supported living are mentioned in the annex, and I can't see them, Mags. I just quickly, that's why I was turning to the side and just quickly searching and finding the annex, and I have put that annex link to you, Mags, in my reply, but I can't see, I've searched on both REACH and standards, and I can't see them in there, so definitely worth responding and saying that you wanted those including. Don't know if we have any other questions.
Right. So we're having many thank yous coming in, and if there are no more questions, I'll call it to a close. Would Carol or Julian or Sharon like to say anything more?
Well, just thank you very much for coming along this evening and listening to what we've had to say, and really would urge you to respond and please, if you, as Sharon said, if you have used our resources and they've been helpful to you, please make that clear in your response, because the annex to the guidance is looking a little bit thin, and we do need a lot more information in there and good practice. So thank you, everybody, and I'm sure there'll be much more by way of communication on this subject coming your way. So
Absolutely.
please do keep engaged with it.
Thank you. And if you would like to make a small donation, it's optional. I've put the link back on the screen, but we'd just like to thank you for coming and asking the questions you have, and feel free to enjoy the rest of your evening. Thank you.
Thank you for all the lovely thank yous you're sending
Yes,
in.
they are really lovely.
Right.
Thank you very much.
Yeah.
Thank you.
Okay, I'll end the session now. Thank
Thanks.
you.